Well, good morning, everyone, and welcome. I'm Susan Demas, the executive editor here at Lincoln Square. And joining me today is Irin Carmon, a journalist and commentator who is very well known for her coverage of gender, politics, and social justice. She is currently the senior correspondent at New York Magazine and a contributor to CNN. She co-authored the best-selling biography, Notorious RBG, apologies, The Life and Times of Ruth Bader Ginsburg. And she is also the author of the upcoming book, Unbearable, 5 Women and the Perils of Pregnancy in America. Thank you so much for being here, Irin.
I'm thrilled to be here, Susan.
Wonderful. And the book comes out in October, correct?
October 28th.
Great. Well, you've focused a lot on covering reproductive health care in your journalism career at Jezebel, MSNBC, now at New York Magazine. And this was all long before the Dobbs decision in 2022 overturning Roe versus Wade. So I'm curious why you've decided to focus so much on that issue.
You know, it started while during the first wave of Republican attacks on reproductive health this is a long-standing battle that began right after Roe v. Wade was decided. You could even say it started in the 19th century. But our contemporary struggle over reproductive rights, the time in which the anti-abortion movement really started to triumph or to show its real agenda, was when the Tea Party Congress took over, and the number one, the HR 1, their first bill that they introduced was defunding Planned Parenthood.
So back in 2010?
Back in 2010, yes. When they were elected, in 2010, and it was January 2011. And and I also became really interested in the legal struggles and how judges were trying to figure out how much to chip away at Roe v. Wade. Over the course of that time, I realized that reproduction so profoundly engages fundamental things about our lives, whether it's our values, our connection to other people, our dominion over our bodies, how we think about gender roles, how we think about our health, how we think the government should be constructed, who should be in charge of what. And it seems an endless debate has been kind of waged over our bodies. And so I have been really interested in how people live that, including how governments try to legislate it. But with this book, I really wanted to deepen my focus on how people actually experience the impact of these policies in their daily lives, and then to step back and to put them into political and historical context.
Yeah. You know, I found that as a political journalist, there was a lot of pushback, and not just from male editors, but even from some of my female colleagues over the years when I covered abortion rights, because it was somehow considered a less serious issue. And actually a good way to prove that you were quote unquote objective as a female reporter was to do pieces on the anti-abortion movement. There was also this prevailing idea that Roe would never be overturned. This was some scaremongering from Planned Parenthood and from Democrats. And so I'm wondering if those are some issues that you also encountered over the course of your career.
100%. You took the words out of my mouth. I mean, how many of us were called either marginal or hysterical, Chicken Little? These are all things that, especially female journalists, there are some great male journalists who were also sounding the alarm all these years. I mean, I will say, as a reporter, I've spent a lot of time with anti-abortion activists, but I think that the difference was, do you take them seriously in terms of what they actually intended to do? Or do you treat them like a sideshow? Because as we know right now from what's happening, and particularly what happened with Dobbs, they are dead serious.
Right.
You know, I think that it was considered fashionable to treat it as a kind of, people even said when Roe v. Wade was overturned that the dog caught the car, that Republicans weren't actually serious about banning abortion, that they just wanted to use it for politics. But, that moment that I mentioned in 2011, I think in some ways was an unmasking in which, these restrictions were being passed at the state level, they were being introduced at the federal level, and they were absolutely serious about restricting access to abortion while also, and this is a really core part of my book, making pregnancy worse for everyone. So, I think my interest as a reporter began in covering the legal and political struggle over abortion. I then had the chance to report all over the country about the impact of those restrictions. And then in 2019 and 2020, I was pregnant joyfully, and the pandemic happened. And I had an opportunity to report on what was happening inside hospitals as people were trying to navigate both COVID and how they were going to have a baby in a hospital in most cases, because that's where 98% of births take place. And I think that what became clear to me, and one of the reasons that I wanted to write this book, is that we tend to talk about abortion in a vacuum. We tend to say, okay, but this will only apply to people who need abortions, or it might even only apply to low-income women, marginalized women. Both of my pregnancies occurred at huge crisis points of the country. The first one was during COVID, when all of a sudden medical care was turned inside out. And I found that, there was so much confusion and panic. There were women giving birth alone. There were babies being separated from their mothers because they had COVID. A lot of perhaps well-intentioned mistakes that cost a lot, and a lot of complications from COVID, making pregnancies more dangerous and increasing maternal and infant mortality. And then the second time that I gave birth was I was actually covering the Dobbs leak, 6 months pregnant. And I realized, by experiencing as a very privileged, married, educated white woman who has reported on reproductive rights for 15 years, that I was being treated like a vessel, albeit in a totally different context, with my desires, my questions, my informed consent being kind of trod on. And I was really lucky. I had a textbook easy pregnancy. But during the course of reporting on both of those things, you remember how after Dobbs, suddenly we started hearing about women who were not seeking to end their pregnancies, but they needed emergency care. And these cases, as we know, are still happening every day. Do you remember the shock that people felt? Like, what? Why aren't women getting miscarriage care? Well, people who had been paying close attention understood that, in fact, it was much bigger and much deeper than abortion, and that if you tried to ban the so-called bad women's pregnancy health care, it would end up having impact on all kinds of women that supposedly you weren't going for in the first place.
Right. Yeah, it does seem to me that a lot of our discussion about reproductive health seems to rest on this false dichotomy that good women give birth and bad women have abortions. But, in reality, about 60% of women who have abortions are already mothers. And, we've seen in states that have banned abortion after Dobbs that pregnancy care has suffered too. In Idaho, I know, for instance, they're facing a huge shortage of OB-GYNs. You have to travel miles just to get care if you're pregnant and you want to give birth. Women have been miscarrying in ER parking lots because hospitals are concerned about their liability, and several women have died, which is something that you have wrote about, both in this book and also for New York Magazine. So, in reality, there is this wide spectrum of reproductive health care. Do you think that abortion bans have ironically demonstrated that and changed the debate in some way?
I think, unfortunately, for some people, it had to get much worse in order for them to understand what was really happening here. I think people who are paying attention do understand these connections in ways they may not have. Perhaps they would have been kind of casually pro-choice, but they wouldn't have thought that it would ever impact them. And now I think people see a broader spectrum of pregnancy being affected by this. And the other thing is that, this really surprised me. In my book, I tell the story of 5 different women. 2 of them are in New York City and 3 of them are in Alabama. And I found these interconnections in places that I wasn't even looking for. So, for example, one of the women that I write about, Allison, she is trying to get pregnant in Alabama with her female partner, and she's experiencing recurrent miscarriage. And just then, Alabama decides to ban IVF. I think that was another clarifying moment where, where people were like, what, IVF? Now, of course, if you had been listening to the anti-abortion movement, you would have known that Most of them quietly opposed IVF because they saw the fertilized egg as a person, allegedly. You would also argue that IVF is another tool that allows you, the individual, to control when you get pregnant, or at least more control than you might otherwise. So having infertility care be affected. In her case, having miscarriage care when she miscarried 3 pregnancies. In the first case, even though there was no fetal heartbeat, and even though anti-abortion activists have told us a million times that miscarriage care will not be affected,
Right.
she did not get choices or the standard of care in her miscarriage care, and wound up going to an abortion clinic, a former abortion clinic, because by that point, abortion was illegal in Alabama, but that wasn't afraid to give her even an ultrasound to tell her if the miscarriage had completed. And so somebody going through something so enormously personal and painful has nothing to do with needing an abortion, although obviously I personally think if she needed one, then she should have gotten the care she needed too. But even in these instances in which abortion is not part of the conversation, abortion politics are poisoning her care.
Right.
And at the same time, another of the women that I write about ended up needing an abortion because she hadn't gotten her period back after a traumatic birth, and didn't realize that she was in the process of hormonal therapy because of the impact of the blood loss from her first birth. And so she wasn't actually even aware she was pregnant until she was several months along. And she wound up, and she thought, I have no idea if my body can even support a pregnancy. I have no idea how the hormone therapy that I've been taking will affect a potential pregnancy. She had the fortune of living in New York City. It was the week that Texas banned abortion at 6 weeks on the theory that women should be able to know that they were pregnant before. And so when she went to Planned Parenthood, having had this really traumatic birth that I write about in the book, she was treated with such care and respect. And she actually told me that Planned Parenthood was the best prenatal care that she ever got because it put her at the center as a patient.
Yeah. I'm struck by these intimate stories that, you've decided to tell. And it's a different approach to the subject than we usually see, in journalism, where it's, all about the poll numbers on abortion and, just very clinical about, this state has done this and this state has done that and the Supreme Court decisions. But, this kind of brings it home that this affects people at the most intimate level. And I'm just wondering, was it a challenge for you to share your story as well?
Yes, it was a challenge. I think as a reporter, I respect people who can do memoir really beautifully, and it hasn't been my focus.
Mm-hmm.
But as I mentioned to you, I think it was part of my journey of why I wrote the book the way that I did. After the Dobbs leak, which it was a very strange moment for me because I was actually sitting the way I am now in front of my laptop, about to go live on Chris Hayes' show to talk about Republicans introducing a national abortion ban to Congress. And they called me and they said, check your phone. And the Politico story had gone live like 1 minute earlier, and we just went live. I'm like scanning it on my phone. We went live like 2 minutes later on the air. And before I even had a chance to process it, I was thinking about how at that moment I was, as I mentioned, 6 months pregnant, and it was a joyful event in my life. And it was also this complete takeover of my very bones. This was something so personal, so transformative. Everything from your eyesight to your shoe size can change in pregnancy.
Yeah.
You could die, of course, but there's a lot of things short of death that are fundamentally transformative. And the physical intimacy of it, the grossness of it, the beauty of it. It's amazing to be able to do it when it's something that you really are undertaking, of your free will. But it is also something that can be wretched, even under great circumstances. And so I think that really drove home to me, like, how dare they? And when I got a chance to read Alito's draft decision in more detail, I was so angry that I started writing a piece that was partly the inspiration of this book called I Too Have a Human Form, because there's this part where he's quoting the Mississippi law that the court was considering. where he says, at 3 weeks, this happens in fetal development, and at 4 weeks that. Now, it's very context specific, because I was sitting in front of ultrasounds being like, wow, cool. But to have the state impose on you the meaning and the value and the relative value to your own life and your own needs filled me with such outrage. And I wrote a piece called "I Too Have a Human Form," because there was a line in the decision where he quotes the law saying, "has taken on in all respects the human form." And I thought, there's nothing in here about the person whose body is taken over willingly or unwillingly, and is incurring enormous medical risks. The blood volume is like doubling. It's hard to breathe. It's hard to sleep. Every part of your life can change. Your mental health, of course, thrown into complete whack. The postpartum period is the most dramatic change of hormones in the shortest amount of time that can happen to a person's body. And so in that sense, I felt like I had to talk about my own perspective. And I talked a little bit about my experiences in the medical system. And I'm careful about this because the stories that I write about are enormously heart-wrenching, and they are, they involve maternal mortality, and they involve criminalization, being thrown in jail for a positive pregnancy test, and loss in all different kinds of ways. And so I want to be clear, in many ways, I was enormously lucky. But what I wanted to do was to restore these broken down connections between all these different experiences of pregnancy. So I wanted to explain how I came to see all of these as very interconnected, because I felt at that moment that we learned that the worst that we feared was indeed going to happen, as opposed to maybe some kind of like muddy middle step, which was the other possibility. They could have upheld just the 15-week ban. Once it became clear that they were really going to do it, at least according to the draft, that was verbatim what they ended up doing in full force of the law, I thought, I'm getting off the sidelines as the reporter, and I need to make clear how much fury this makes me feel, even though I have a lot of the things that I think everybody should have. And but that said, there were still indignities along the way in my own pregnancy care that made me think, like, how dare you? I talked to Tressie Cotton McMillan about this a little bit, and she talked about how in some ways, pregnancy healthcare, which is the most common reason that women are hospitalized in America, even now, is a way in which certain people, privileged people like myself, can end up being treated in a way that many people are used to being treated in the medical system, which is like you're an idiot, or like you deserve less than full dominion over your body. And I wanted to the extent that I wrote about my own experiences in a limited way, was to understand how I got on this journey of seeing how all of these women's stories were deeply connected, and then trying to understand the why of it, trying to understand the history of why obstetrical care is like this, and why is it so hard to get midwifery care, and why is abortion so separate, and also what's the ideology leading to the fact that Allison can't get miscarriage care. And it is all very intentional, and understanding that it's deeply rooted in American history was also one way that I wanted to make all those connections.
Yeah, your book really reminds me of that old second wave feminist slogan, the personal is political. And I've been a political columnist since I was in my 20s. And, at times I was the only female political columnist in the state of Michigan. And so I found, for the first several years that I did that, I never talked about my personal experience because I wanted to be taken seriously and talk about serious political issues. But at this point, now I'm well into my 40s. I've written several columns about reproductive rights that, I do include my experience as a mom, as someone who's been pregnant, about my painful miscarriage, because I believe in being honest with my readers. And, I've written about how when I've covered events where anti-abortion activists carry these big placards of fetal remains, that brings me back to my miscarriage. And I know I'm not alone in that. And so I'm wondering if you think more women now feel it's okay to talk about these personal issues. Now, things that we've been told for years are just personal and, they're not serious. These are, private conversations.
Well, I hope that people feel safe enough to share their stories. I completely understand in a time where anything that you say publicly can be weaponized against you, including criminally, people might be reticent. But I think that the more people who open up and tell these stories, the safer it might feel for others. I mean, that is how we got Me Too. Yes, we're in the grip of a fierce backlash, but it won't last forever. And I think that there are only going to be a certain number of people who, think that they're going to be impacted by the legal and political changes when it comes to reproduction. But I think the more people say, actually, you think that this is happening over there, but it happened to me.
Yeah.
And you talked about, it's so disrespectful to bandy about those photos of fetal remains when, for example, it could be very painful and triggering to somebody who experienced a pregnancy loss. And you also mentioned the statistic of 60% of abortion patients already being mothers. It's also an assumption that the people who are walking into that clinic don't understand the full meaning of the decision that they're going to make. And I think that is a profoundly patronizing, I guess, intentional word here, assumption that is so fundamental to how we got here. All of the women that I write about in the book and all of the history, it's all connected because it's a fundamental disrespect of those of us who are bearing the physical burdens of pregnancy. And I think if we understood that better, and if we understood how even a textbook pregnancy or even something as common as miscarriage can deeply change you and involves an enormous commitment that nobody should have imposed on them, then maybe we would be in a different place than where we are right now. Or maybe more people would be pushing back as the Trump administration actually makes a very bad, historically determined status quo worse.
Right. And so now here we are 3 years after the Dobbs decision, and now we're dealing with Project 2025, which, has been a blueprint for the Trump administration in many ways. And one thing that I've always found interesting, for me, it always made sense. Abortion is a feminist issue because, there's no more fundamental right than, the right to control your own body. But there's been this counter argument, and I think it's gotten significant media attention over the years that you can be a pro-life feminist, and that's kind of the logic behind anti-abortion groups like, the Susan B. Anthony Foundation. But it seems like that's kind of been laid. The reality has been laid bare after Dobbs because, with Project 2025, which, came out of the right-wing Heritage Foundation, it goes well beyond, abortion rights and, this vision for a surveillance state, to enforce that. It's really about enforcing traditional gender roles, tearing down civil rights protections for women, for LGBTQ people, for instance. This idea of like giving cash bonuses for having more babies, kind of things that are remnants of, Germany in the 1940s. And so, I think that now people are ready to take seriously the argument that taking away women's rights is a key part of an autocracy and a key part of this vision under the Trump administration. But, I was wondering if you could talk a little bit more about that, because again, a few years ago, this seemed to be one of those arguments that would be just dismissed out of hand, like the idea of Roe being overturned.
I think I would be more likely to give so-called pro-life feminists the benefit of the doubt if they had lifted a single finger to try to make pregnancy safer for the people who are going to undergo it.
Yeah.
And so the president that they helped elect twice, cutting Medicaid funding that is so essential to the vast majority of births, and also to making sure that people are healthy before they have babies, which is also a reason for our catastrophic maternal mortality rate, is that people are beginning from from lifetimes of chronic disease, of being uninsured, not being able to see a doctor. Even in states that have pregnancy Medicaid, you have to jump through so many. I mean, they all have pregnancy Medicaid, but for states that only provide it to pregnant individuals because the bar to get Medicaid is so low, like Alabama, which I wrote about, you have to jump through so many hoops that you're actually a few weeks or a few months into your pregnancy by the time you can get prenatal care.
Right.
And they've just started allowing it so that women don't get thrown off their insurance 6 weeks after giving birth in many states. I mean, this is a thing they just woke up to because they were politically shamed into doing it.
Right. I have to say, I was also really struck during COVID where there was an argument from a lot of people on the anti-abortion movement against mRNA vaccines, this argument that it's destroying life, with fetal tissue, and encouraging pregnant women not to get the vaccine, which was incredibly damaging, and was, as ProPublica did this incredible series, resulted in so many stillbirths, that completely cuts against, what the pro-life movement is supposed to be about.
I mean, it's the same toxic soup that we've now seen come to power at HHS. And what are they doing? They're eliminating women's health funding, research funding to women's health. In the end of my reporting on the book, for the epilogue, I was interviewing an expert on maternal mortality and birth equity outcomes, why it is that the racial gap in maternal mortality in the US is so bad, and why in New York it's actually worse than Alabama. And she told me that, and part of that is because it's worse for everyone in Alabama, but it's still something that is very shameful for New York, is that the research that she was doing in that very moment was getting cut off because it had the word equity in it.
Oh.
And it was considered DEI. So again, I think that there have been many examples in which the purported interest in women's health has been shown to be totally insincere. Even those baby bonuses, which would have been inadequate, but perhaps as part of a suite like they do in Western Europe would have been fine. They haven't happened.
Right.
They're not going to happen. It's just going to be rhetoric about how women have to have more babies. Women have to have more babies, being more unhealthy, having less access to medical care, and having less control over the outcomes of their pregnancies than ever. No wonder women are voting with their feet and choosing to have fewer or no children. I mean, there was, I quote a poll in my book about how women were choosing to have fewer children, and they cited fear of post-Dobbs pregnancy care as part of their thinking. Now, with respect to the mRNA, having been pregnant twice during COVID, both before and after the vaccine, it's tragic. I received a booster during my second pregnancy. In my first pregnancy, the COVID vaccine wasn't available, but I enrolled my first child in a COVID vaccine trial, and we drove 9 hours each way for each visit because I was so serious about protecting my child. The booster that I had in my second pregnancy, I had the antibodies tested of my second daughter, and they were off the charts because I was able to pass them on to her prenatally. And by then, my older child was in preschool, and they both, everybody in the house got COVID but the newborn.
Oh, wow.
And she was still the age where, and we had been under lockdown for the whole first couple of years because of, just being pregnant, then having a newborn, then being pregnant again. But it was time to send the 2-year-old to preschool, and it was the fall of 2022. And the only reason the newborn didn't get COVID at a time where fever would have had to make us go to the ER, I believe, was because we had our antibodies tested and they were off the charts from me getting a booster. at the same time that they tell you to get the Tdap booster in pregnancy. And so it's worsening infant outcomes too. And we do know that it turns out that there's really good data that that pregnancy and COVID add up to more complications, both for the pregnant individual and the baby.
Right. It seems to me that, one of the underlying ideas behind abortion bans and just this overall attitude towards women's health is that, suffering should be part of pregnancy, and you shouldn't complain about it. If you're a quote unquote good woman, this should be just part of the deal. And somehow paying attention to women's health is part of this DEI movement. And, it seems like there's just this level of contempt for women's experiences that's a through line throughout all of this.
I absolutely think that that's the case. I think that the theme of punishment is one that comes up again and again. There is, of course, some Christian thinking about Mary and pain and suffering and biblical sacrifice. But I also think that it's the consequence also of seeing really strict gender roles in which one does the sacrificing, the pain, and the caregiving, and the other does, whatever MAGA thing they're talking about right now, going to the gym, taking supplements. I don't know. It's hard to keep track of what their ideal masculinity is because of how it's so far gone from any even notion of like chivalric provision. I will say, yes, I think as parents, we know that being parents involves sacrificing and pain, but there are so many ways in which America makes it so much more painful, so much more punishing than it needs to be.
Right.
80% of maternal deaths are preventable, according to the pre-RFK Jr. CDC. And we, even if you quibble about the types of measurements, we will still rank last, even when you adjust for all the different ways that people measure maternal complications and death. We will always end up last on any list of wealthy countries. It's not magic. I think we know how to improve these things, and we just choose not to.
Absolutely. I was wondering, going more to the political side of things, abortion was a potent issue in the 2022 midterms and definitely helped Democrats win some key races. Although I should note, a lot of pundits insisted all the way up to Election Day that would not be the case and inflation would be the number one issue. But it did seem to fade in importance in the 2024 presidential election, even though now, like, at least a third of all women in America live under abortion bans. This is only expanding. Do you think that part of this is that we have short memories? What is going on in terms of how people are viewing these bans?
So I think Trump was pretty diabolical in messaging on this. He managed to distance himself from his signature domestic achievement.
Right. He appointed 3 of the justices that overturned it.
And he bragged about it. I mean, he bragged that he would do it. He bragged that he did it. I think he was surprised by the political ramifications of it. The fact that he was able to convince people that he didn't have anything to do with it, or that this would remain a states' rights issue. I have to say, one way in which I was very wrong in 2024 is I did not think that the states' rights argument that he made was going to work, where he said, I just think it should be left to the states. I thought, like, most people don't care about process and they're hearing these terrible stories in all kinds of states. But I was wrong. And when I think about why that worked, I think people hear what they want to hear from messengers that they decide to trust. Mm-hmm. They didn't trust Joe Biden on this issue. Kamala Harris barely had a chance to define herself on this issue, even though her policy platform was excellent. Mm-hmm. By that time, it was being drowned out by so many other things.
Right.
Anybody who was listening to it heard him say, in your state, you'll be okay.
Yeah.
I was wrong about how potent that would be, because people at that point were only hearing what they wanted to hear.
Right.
They were already deciding to vote for Trump. The people who were in the states where abortion is illegal, they don't live in swing states.
Right.
And the places where maybe they're purple, places like Michigan, for example, well, they had a state referendum and they
In
kept
2022. And
right.
so you feel safe, even though obviously the federal government can trump that.
We know that, and I think that message got lost. So I think that as effective as these state-by-state, and as important as they were, these state-by-state measures that protected abortion in purple states and in blue states made sure that all the laws were updated the way we did here in New York, unfortunately, I think gave people a false sense of comfort if they were in a significant swing state, or perhaps if they lived in New York, they thought abortion is not going to be illegal here no matter what. And then the states in which abortion was illegal, unfortunately, most of them are Trump states. So it wasn't going to change the status quo for them. They were going to vote for Trump. The abortion was going to be illegal. The fact that a federal abortion ban is within close sight, or that they can do it through death by 1,000 cuts, such as making medication abortion really inaccessible, or continuing to make Planned Parenthood clinics that could provide abortions financially infeasible because they can't get Medicaid reimbursements for non-abortion services. All these ways in which they can make abortion much more difficult to access. And by the way, all the ways that the abortion rights movement has fought to adapt to these horrible laws, ironically, I think gave people a sense of complacency about it. So for example, telemedicine, being able to mail pills, the Biden administration facilitated that by making it possible for these pills to be prescribed safely by mail without an additional visit.
But that could be reversed.
All that can be reversed.
They could go back to the Comstock Act.
Exactly. And there's a lot, and the fact that even, there were federal decisions that continued to keep the abortion pill legal, all of these things can, and I hope they don't, but they very likely will change. So I think that for people that it mattered, they kind of thought, he says it will still be down to the states, and they rationalized that to themselves, a decision that they were probably leaning towards anyway.
Yeah. It seems over and over again that a through line with Donald Trump is people don't seem to believe that he'll do things that he's promised to do, but I guess that's part of a larger discussion. I can't let you go without talking a little bit about Ruth Bader Ginsburg, because you've written so much about her. You interviewed her. Your first book was about her, and she's definitely become one of these cultural icons, which is pretty unusual for someone who was in her 80s. But one of the debates that seems to be ongoing is whether she made a mistake by not resigning under Barack Obama, because, of course, when she did die in 2020, Trump was able to replace her just a few weeks before the election with Amy Coney Barrett, who was one of those, votes 2 years later to overturn Roe v. Wade. And so what's your take on that debate? Is that unfair to her?
So I think she did make a mistake. It's very clear that she made a mistake. I think I understand why she did it without defending it. I mean, one of the things as her biographer that I seek to understand is, why would she make a certain decision? In her case, like many people, she didn't believe that Trump could win. And before that, the same things that had made her the path maker that she had always been, her stubbornness, her determination, her blinkered view sometimes to say, I can do this, also led her to make the wrong calculation with respect to her retirement. But I
remember reading in an interview where she said, no one could nominate a justice like me today. I know that.
That's possible, but I think it seems clear they could have nominated a really good one. Ketanji Brown Jackson, an incredible justice. Sonia Sotomayor, an incredible justice. They were all appointed well after her. But I do think that if she had listened to other people's advice at earlier junctures in her life, she wouldn't have become who she was, because she was from an earlier generation where people were telling her no all the time. I think that's what was going through her head. I think the era in which she became the notorious RBG was when she was raising the alarm about precisely the things that are happening now, saying, The court is losing its path, its respect for precedent, its respect for rule of law. Pay attention. This is what is happening. And I think she felt like she had so much more work to do to undo that damage. Now, the question of whether she should have retired, I think, is a separate one to whether she is to blame for everything that happened, whether that's Dobbs, where she was a champion of reproductive rights and justice throughout her career, both through litigation and through legislation, and as a justice and as a judge. The outcome that she most fought to prevent didn't require Amy Coney Barrett. It just forfeited. We know that all three of Trump's justices voted for it. We know that John Roberts voted for the outcome, if not the full reasoning, right? So they needed Amy Coney Barrett for window dressing, but they did not need her in order to overturn Roe v. Wade. And they might have done it in 2 decisions instead of 1. But the fact that they all, including Brett Kavanaugh, I mean, where is the anger at Anthony Kennedy, who had been a defender of gay rights and reproductive rights to some extent, and made way for Brett Kavanaugh, who has voted in lockstep with the Trump administration's agenda, or John Roberts, the supposed defender of institutions, who has also enabled so much of the Trump agenda, including overturning Roe v. Wade. Now, he wanted to do it. He wanted to uphold the Mississippi law and not say we're overturning Roe v. Wade. But once you got rid of the viability standard, Roe was effectively gone, and it would just require maybe some appeals court judges figuring it out. But I think that there is, I understand that there's a lot of anger at her decision not to retire, but I think it's a simplistic explanation to blame the decades of the right-wing legal movement, the anti-abortion movement, the Christian right, to say that they finally got their wish, not because they had a mix of enormous resources, strategy, doggedness, willingness to play dirty, and in some cases luck, to put it on the shoulders of a feminist woman who tried the best that she could. I'm not convinced.
But that's a very common story in America, isn't it?
Blame a woman?
Yes.
Yeah.
Well, Irin, thank you so much for spending so much time talking with us about your book and all of your work. And I certainly hope that, in the future we can talk with you again, because these are such critical issues. And your book takes such a unique look at people's stories, the people who are being impacted at just the most intimate level by these, decisions that, are being made by, 9 justices in robes very far away. So thank you so much.
Thank you. I really appreciated our conversation.